Well, good evening, everyone, and welcome to our webinar this evening, Blood Sugar Boot Camp. We've got a lot of great information for you and a wonderful speaker. So we're excited that you're here to join us. It will be an interactive program. Our format includes a short presentation followed by an interactive discussion. To type in a question, use the question section of the webinar toolbar. At the end, you'll have a chance to ask questions. So we look forward to an interactive webinar this evening. Just a disclaimer, we know that the information you're about to hear may motivate you to make lifestyle changes, but please consult your physician before making any changes to your current routine. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Care and Education Specialist. So our webinar leader this evening will be Wendy Greger. Wendy is a registered dietitian and certified diabetes care and education specialist. Wendy has been with Cecilia Health since 2017. She also works with her local hospital providing nutrition counseling, diabetes classes, and diabetes prevention classes. Wendy works individually with patients who are having trouble reaching their health goals. She believes that through compassion, knowledge, behavior modification, and motivation, patients are able to step by step walk toward better health and a better quality of life with diabetes. Now, let's listen to Wendy's presentation on Blood Sugar Boot Camp, where she will empower you to take control of your diabetes through glucose self-monitoring. So, thank you so much, Wendy, for being with us this evening, and you may take it away.
Hello, everyone, and welcome to our presentation tonight. What I'd like to cover is some of the benefits of self-monitoring and helping you answer that question is, why do I check? Why do I poke my finger all those times? And what would I do? Why would I do that? I'd also like to share your blood sugar and your A1C targets. I have 5 case studies that I hope you find as fascinating as I do, and I'm going to walk you through each of those and share with you personal experiences from my patient population, and then teach you how to interpret your blood sugar log, how to read those logs, and how to get the most information. And then we're going to finish up with some information about how to get a good blood sugar sample, how to treat low blood sugars, and then jump into your questions. So we're talking about a blood sugar meter, and technically that's called a glucometer. And the glucometer that you're using is an important tool in your self-care. And this meter is really for you alone to answer your questions. And some of your providers will look at your data, but I bet if we took a poll, many of you would say that your provider doesn't look at your data for a lot of reasons. Sometimes the appointments are very busy and they have a lot of things to go through. Sometimes patients will go to their doctor and the doctor will say, well, how are your blood sugar numbers? And patients will present their meter. Well, there's, gosh, many meters on the market. Doctors probably don't even know how to get into your meter memory. So there's a variety of reasons why providers don't look at the numbers, but I'm going to coach you on how to prepare a presentation to share your data with your doctor, because I think it's going to be so helpful in having you get better care from your physician. So who should test? First of all, anyone with diabetes should test their blood sugars. You ought to know. And I'm going to share with you what you're looking for. And also people that are taking diabetes medications and people that are taking insulin will definitely need to test their blood sugar. And we're checking your blood sugar to answer questions, and lots of questions like how are your food choices impacting your numbers? What happens with activity? And then what's happening with your medications? Are your medications working? or what medication would help you achieve better control. So all of these questions can be answered with your meter and your logbook. And so basically, I want you to take off the blindfolders. Take the blindfold off so you can really truly see what's happening inside your body and how is it impacted by what you eat and what you do and what you take, all of these things. So that's why we're going to check. Let's look at case study number 1. And this is Carol. And as a little background, I'll share that Carol has an A1C of 7.1. She takes metformin, 1,000 milligrams twice a day, and she tests her blood sugar every morning, every single day. She tests her blood sugar, and her fasting average is 127. And this is, well, it's not, what you're looking at is technically my rewritten log of her blood sugar log. I give patients this piece of paper, and it has all of these columns, but most of the blood sugar logs come back a little bit messy. So I've rewritten it, but this is actually a patient's blood sugar log. And so the first thing I do is I go through with them and we circle elevations. And so anything above 130 is going to be circled, and then we average up the whole column at the bottom. And to do that, you would use a calculator and add every single number and then divide by the total number of tests that you have to create an average. So I can't remember if this is 3 weeks of data. So it's like 21 data points. It might be 22 or 23, but anyways, you take the total sum of these numbers divided by 21, and that gives you your average. So that is the math that we do to come up with the average. So, when you look at her data for before breakfast or her fasting, when does Carol have high blood sugar values? We don't know, because we don't know what's happening the rest of the day. Can Carol reduce her A1C without more medication? We're not sure. And if your doctor doesn't know, how you can lower your blood sugar yourself through self-management, and the doctor wants the A1C less than 7, doctor might make an adjustment to the medicine. And so I want you to be able to see if there's something you can do without taking more medicine. So let's talk about what are those targets. And these recommendations come from the American Diabetes Association. So before meals, your blood sugar should be somewhere between 70 and 130. And 2 hours after the beginning of your meal, so I always say 2 hours after the first bite, should be less than 180. I hope you can grab a piece of paper and jot these numbers down so that they're going to be something you can refer back to. Notice that the top of the goal for before meals is 130, and the top of the goal 2 hours after is 180, and that's a maximum rise of 50 points. So a general recommendation that I recommend you consider is that a meal should have no more than a 50-point rise from pre to post. So that's our target. That's what we're shooting for. And these numbers, however, can be individualized. And we have on this slide, talk to your doctor, because depending on how long you've had diabetes or depending on your age or other medical conditions, your doctor might give you a more liberal goal. So that's a possibility. Or if you've just been diagnosed with diabetes, your doctor might say, well, before meals, I'd like you 70 to 110. So, talk to your physician and get your specific targets. And now I want to spend just a minute talking about A1C targets. The test is called HgA1C. It's hemoglobin A1C, and the American Diabetes Association recommends, or actually the way they diagnose this is that prediabetes has an A1C of 5.7 to 6.5. People are diagnosed with diabetes if their A1C is greater than 6.5, and the target, our goal, is to have people have an A1C less than 7%. Why? Why do we pick 7%? It's because the majority, the preponderance of research that we've done on people with diabetes demonstrates that you have a lot less complications. Complications really are um, much reduced when you maintain an A1C less than 7. When your A1C goes up above 7, you start to see complications really take off. And so that's why. And again, that can be individualized. So ask your physician, what should my A1C be? What would you recommend? And for some patients, they might say, well, I recommend that, it would be great if you were under 8%, or definitely want you under 7%. So those are questions to discuss with your doctor. But I want to point out that our patient Carol had an A1C of 7.1, and that represents an average blood sugar of 157. So I'm gonna go back one and say, I'm gonna go back two. If Carol's average in the morning is 127, but her A1C is 7.1, and that's an average of 157, she's much higher than 127 the rest of the day. And that's what we need to find out. Where are those other high blood sugars so we can try to have a positive effect on those? All right, so this is case study number 2. This patient is Michael. His A1C is 6.0. He's doing really well. He doesn't take diabetes medications. He wants to keep it that way. His A1C he's actually, technically without diabetes medications, he's pre-diabetic. And yet, he may have been higher than that to get a diagnosis of diabetes, but he's done such a good job of controlling his numbers that he's gone down into the pre-diabetic range. We call that putting your diabetes in remission. And for people that are new to diabetes, it's a possibility that can happen. When I saw Michael, I asked him I said, well, let's see what your numbers are. Let's find out what's going on. I said, please test twice a day. And I gave him this log, and I had him vary the times that he tested so that he has numbers in every single column of the log. And so before breakfast, he would test before and 2 hours after breakfast one day, the next day before and after lunch, the day after that before and after dinner, and then he'd do one in the morning and one right before bed. And then that would repeat: breakfast, lunch, dinner, split, breakfast, lunch, dinner, split. And he did this very carefully for me for 3 weeks, and then came back to see me, and we went over the results. And what we were able to see is, with his fabulous A1C without medications, where do you run high? And I have circled all of the elevations, and then I also indicated where there was too much of a rise. So before dinner, he was 129, but he was an 81-point rise, so that after dinner, he was 210. Here, 126, and then 178 after dinner. 60-point rise, 77-point rise, 79-point rise, and you can see with the average, we look down at the averages. He's great at breakfast time. He's great at lunchtime, and his problems are all right here at dinner. So then we can say, you know what? You're doing a great job with breakfast and lunch. Let's look at what you eat at dinner, and how can we modify that meal so that you only have like less than a 50-point rise. And once you've done that, we know that you're doing everything you can do to get these, to keep your diabetes in remission and to keep you healthy. So how many high values did he have? We could count those up. When did he run high? It was all around the dinner meal. So the dinner meal's the problem. And can he fix the highs without medications? I bet he can, because he just needs to change his diet. And then if you need help figuring out how you can change your numbers with your diet, you can talk with your diabetes health coach. Your Cecilia Health Coach will help you when you've done your blood sugar log and you want to discuss how to make those changes. Okay, now case study 3, Teresa. So I gave Teresa the same exact assignment as I gave Michael. And, things happen. She came back with a log that looked like this. She tested 4 times a day. I didn't even ask her to do that, but she did. So I thought, okay, for 3 weeks, she tested 4 times a day. We have a lot of data. And so this is real life. This really happened. Her data average from breakfast was 107, and 2 hours after breakfast, her average was 173. So you see she was going up more than 50 points, and you see so many elevations here after breakfast. So keep that in mind. And then at dinner time, there were several elevations. 116 though is still a good average. We want her less than 130 before the start of the meal. And then only a 22-point rise here at dinner with an average of 138. So on the whole, her dinner meal is doing fairly well. It's breakfast that's the problem. And so then we talked about what she was eating. So the questions are, where are most of the high values? They're after breakfast. Why are some let me finish the answering this question. So with the elevations here, and then nothing here in the middle of the day, the question was, well, Teresa, how come you never tested lunch? And she said, what do you guess? She said, I don't eat lunch. I eat 2 meals a day. So we looked at the time of her first meal, the time of her second meal, and the solution that we came up with is that she was getting too many carbs at breakfast. And could she make that breakfast smaller and put in something here in the middle of the day so that she could remove these peaks and cut down those peaks and maybe add a little something here, which would allow her to reduce the 173 average after breakfast. So that was our discussion. And then the other question we have is, why are some of the dinner values greater than 130? And so then we were able to talk about that. And sometimes after work, before she eats dinner, she would have a snack. She'd have something to eat. And so we really had to talk about what are those little snacks that you have before dinner that are driving you up to 181. So that was a discussion. And the third question we had was, when should Teresa exercise? And so it was possible that if she exercised after breakfast, if that's an option, that would be a great time to pull those numbers down. All right, so that's a little bit about Teresa. And then my next case study is a guy named Bob. And this, I find this kind of funny. He came to see me, and when he walked in the door, I will tell you that he was lower than low. This was the first time I met Bob. He looked sad. He was looking down. He wasn't making eye contact. His body language looked like he was not happy to be there, and he didn't want to come to education. And I said, you know, I was honest. I said, you know what? It doesn't look like you want to be here. And he said, I really don't. And I said, well, why? What's your thought? And he said, because I love to eat and I go out to lunch every day with my friends and we meet at the sushi restaurant. And I know you're going to tell me that I can't do that. And so I was able to turn his frown into a smile, because I gave him a project and I said, so I want you to go, instead of telling you not to go to your sushi restaurant, I want you to go every day to your sushi restaurant. And I want you to take your blood sugar before you eat lunch, and then set your phone to beep 2 hours after the start of lunch, and then to look at your your rise, and keep a record of what you ate every day. And then we're going to analyze that and see. You probably don't even need to see me again, because you could answer your own questions. You just need to modify your food, your menu choices from the restaurant until your rise from pre to post is less than 50 points. So you might need to eat smaller portions of rice. You might need to order more vegetables. You might need to have, changing up the different menu items till you find those foods that you can eat that don't cause more than a 50-point rise. And that was his homework assignment. It was a success story. He was so happy, and he was able to continue to enjoy the foods that he loves, but know how to do them without causing harm. And so case study number 5 is Jason. And Jason is a much tougher situation. His A1C is 11.1. He takes metformin, 1,000 milligrams, two tablets a day. He takes Lantus, 95 units a day. And Jason tested 3 to 5 times a day for 2 weeks. And you can see his data when he came back to see me. Actually, this was his logbook that he brought in to see me the first time, and we were able to look at it. And his doctor had told him to test before he takes injections, and so he was definitely testing before he took his Lantus dose. But we can see that all of his numbers in the morning are quite high, 249, and that by the end of the day after dinner, he's more than 100 points higher. And so I just want you to know that sometimes it's not as simple, and you can't fix this by your diet. Jason is at a situation where he's had diabetes for a very long time. For more than 15 years. He's already taking a very high dose of Lantus with 95 units, and he can't fix this on his own. When you see a blood sugar rise of over 100 points from the beginning of the day to the end of the day, we need to fix that with mealtime insulin. And so the Lantus will only treat, it's a long-acting insulin. It's a 24-hour insulin, and we give you Lantus. We give the long-acting insulin so that we can get these morning blood sugars less than 130. But we can't give him a whole lot more insulin. It's all this rise throughout the day that Lantus will never touch. So he needs mealtime insulin. So the answer there is this gentleman needed to start on mealtime insulin, either Novolog or Humalog or one of those similars, and that will help bring down this rise. Then we can give him enough Lantus to start the day at goal. So those are my 5 case studies. And so let's just talk a little bit about what can increase your blood sugars. So some of the things that will have a very powerful impact on that includes missing medicine. If you miss a dose, if you are taking glipizide or glyburide and you miss that medication, it could cause you to be high all day. Also, if you take insulin at night and you forget your insulin, that'll cause you to run high all day. But also things like stress can cause your blood sugars to really peak. If you get bad news, if you hear that a loved one is in the hospital, stress can drive up blood sugars. Being sick, having a cold, having an infection in your foot or in your leg, any sort of illness can raise blood sugar. If you are usually active and you don't do your usual exercise class, that can result in a higher blood sugar. Or if you have a high carbohydrate meal, or you're eating more carbs than usual, that'll have an effect on your blood sugar. And then overall, if your weight were to drift up, your blood sugars will rise, because as you gain weight, it makes you more insulin resistant, and the insulin doesn't work as well. And conversely, if you lose weight, your insulin will work better and you can see your blood sugars coming down. And with significant weight loss, you might even be able to go off of some of your medications and reverse your diabetes. So it can have a very positive impact. So I want to also mention that this is a hard thing to explain to people, that diabetes is a progressive disease and that over time, all things left the same, sugar will increase. So 5 years, 10 years, 15 years, your sugar will increase unless you're able to change your circumstances considerably, like losing body weight, or getting into an exercise program. But it's a progressive disease, and so don't feel like you failed when you need more medication. And if you can't fix it yourself, that will happen. What can lower your blood sugars? Sometimes if you miss a meal or a snack and you're on a medicine that lowers your blood sugar, like glipizide, glyburide, glimepiride, or you're on insulin, if you miss a meal, you could bottom out. More exercise than usual can lower your sugars. Surprisingly, alcohol on an empty stomach can contribute to low blood sugars because alcohol can decrease your liver's ability to make sugar, to make glucose. So between meals, our bodies make sugar, and if you have alcohol, your body won't be able to make sugar, or it'll make it a lot less. And so having alcohol on an empty stomach can lead to a low. So lower carbohydrate meals or fewer carbs than usual, or weight loss, or becoming more physically fit, all of these things can contribute to blood sugars being lower. So I ask you to keep a log and track the time of day and the date, the time, and whether the test is a before meal or a 2-hour after meal, and keep a log with that information, and track those blood sugar results and see if you can find patterns, just like we found patterns in our case studies. Also wanted to mention that there are quite a few apps that are available that you could track your blood sugar in. My Sugar Diabetes it's called My Sugar. You would go to your phone app store and look up My Sugar, spelled MYSGR, and they have a logbook there. You can enter your sugars and you could print out your sugar log. My Glucose Buddy and Diabetes Trackers are just 3 of the examples of logs. You can also just go to the internet and do a search for blood glucose log, and you'll get tons of images. You click on the image button, you'll get tons of images that you could print right off of your computer. All right, and then I suggest that you prepare a verbal summary for your provider to present at your next visit. And you would say something like, I've been testing my blood sugars twice a day. I've learned that I run high after breakfast, and I'm working on changing my dietary choices to try to fix that high. And I'm struggling with some lows at this time of day, that sort of a thing. So you tell your doctor when you're testing, you share your log, and you present a 2-minute summary as this is what's happening and this is what I need help with. And your doctor will be able to help you and provide much better care as a result of you doing your diabetes presentation. Now, how many times a day should you test? Well, it kind of depends on your situation. First, ask your provider for guidance. You can also ask your Cecilia Health diabetes health coach when would be a good time for me to test. Have that conversation. Just as my conversation was with my case study patients, we talked about when would be a good time to test. People with early diabetes may only test once or twice a day, but you don't have to test the same time every day. You can vary the test times so that you can learn when are you hitting those peaks, and then you'll be able to go in and change what you're doing to try to fix that. People taking oral medications may test 2 or more times a day, but again, your meter is yours to play with. And if you get 50 strips a month, use them, play with them, test when you're interested, test before and after your Friday night pizza extravaganza that you have every week. What is your Friday night pizza night doing to you? Let's ask and answer that question. And you might decide, that you might have one slice of pizza with a salad instead of having 3 slices of pizza, and see if you can still enjoy your favorite foods without hurting yourself. And I'll mention that people taking insulin, mealtime insulin and long acting, so short acting and long acting insulin, sometimes have to test 2 to 6 times a day. But talk to your doctor. I wanted to mention a couple tips on how to get a good sample of blood, because this is really important. First, I want to mention to wash your hands with soap and water. Um, a lot of people are using the sanitizing lotion, and that leaves a film, a debris, not a debris. It leaves a little bit of a film on your hand, and that can interfere with a sample. So you should never wash your hands with hand sanitizer before you test. Always use soap and water. If you don't have soap and water, you can use an alcohol wipe to clean your finger. Or you could sanitize your hands with the hand sanitizer, then take the alcohol wipe and remove all of that hand sanitizer from your finger that you're going to test. So those are a couple ideas. The suggestion to wash in hot water is because it it opens up the capillaries in your hands, and it gets good blood flow to your fingers. And so that is the suggestion. Get your hands nice and warm before you test so that you have lots of blood in your fingertips. Another thing I want to caution you is not to milk your finger. People will squeeze their finger real hard and just squeeze, 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 and milk their finger. That gives a poor sample. So you're supposed to, you can milk the whole arm. You can squeeze down your arm into your palm, and that moves blood into the finger. Then do one poke, one squeeze, and you should have a sample. And testing on the side of your fingertip is more comfortable than on the tip of your finger. All right, next slide. Just a couple words about low blood sugars. Low blood sugar or hypoglycemia is caused by medications and insulin. So certain medications can cause lows. If you're not taking any any diabetes medications, or you're only taking metformin, that doesn't contribute to lows. But glipizide, glyburide, glimepiride, and insulin are the most common medications that contribute to low. And it often happens if you are taking these medicines and you miss a meal, or you eat fewer carbs than usual, or you're more active than usual. So keep those things in mind as helped you understand what has happened when you go low. Word about treating lows. First, we want you to check your blood sugar if you have symptoms. If you feel shaky, your heart starts pounding, you feel flushed, or you feel all of a sudden nervous or uncomfortable, those are symptoms of low blood sugar. Want you to test your blood. And if it's less than 70, then you'll want to do a treatment. And a treatment is following this guideline, the 15-15 rule of thumb, where you drink or eat 15 grams of carbohydrate, and then you would wait 15 minutes and check again. And if your blood sugar is still less than 70, then you would repeat steps 1 through 3 and until you get your blood sugar above 170. But be sure to give it time. All right. In conclusion, I just want to mention that the A1C really gives you the big picture of what's happening with your blood sugar over the last 3 months. It gives you a good idea of how well your treatment plan is working. So if your blood A1C has come down and you're less than 7%, it looks like your treatment plan is working. And your physician will look at that A1C to guide them in deciding, is everything on track? Are we doing what we need to do? But blood sugar monitoring is measuring in the moment. So daily monitoring can show you where you run high, what meal you're running high. How can you change it? What can you do to fix your high? Daily monitoring shows you what to change. And daily monitoring puts the power in your own hands so that you can make the changes that you need to make. If you just look at an A1C, you don't have any idea what to change, but your meter will help you know what to change. All right. So that brings me to the end of my formal presentation. I'm just wondering if there are any questions out there. Please feel free to type your questions into the format you see here at the webinar and be happy to address those. All right. I do see one question that's asking me what I think about using Libre. So Libre is an example of a continuous glucose monitoring device, and it's wonderful. If you are eligible to get a continuous glucose monitor like Libre or like Dexcom, by all means, I would encourage you to try it. This gives you an opportunity to see your glucose all day, 24 hours a day, and Libre allows you to scan your device and then it tells you immediately what your blood sugar is. And think of how it would save you all those finger sticks. And so I think it's wonderful. I'd encourage you, if you are talking with your physician, ask if you're eligible to get something like a Libre or a Dexcom, because the more data you have, the more control you have, the more opportunity you have to lower those blood sugars. All right, I have another question that's asking me, what do I do if my blood sugar is too high? So if you are running above goal, and let's say after dinner your blood sugar is 190 or it's 210, if what you can do is two things. You can think about what you had for that meal and make a decision to change those choices the next time. So you can use that to empower you to change your choices the next time you eat. And then your other option would be to go out and have a walk or to do some exercise, to have some sort of activity that would help your body burn off some of those sugars. I realize that it's not always possible. It's not always easy, or it's not even possible sometimes to go exercise after you get a high. Maybe you're sitting at work and you can't get away to go run around the block, or go take a Zumba class. But at least you can use the data from today to make a change. And I would even suggest try the same meal the next night, but modify it a little. Change the amount of starch that you have. Have salad first. Increase the amount of salad and vegetables that you eat. Increase the amount of protein and reduce the starch. And see if you can produce an improvement there. All right. Let's see. I'm trying to think if there's any other questions. All right, it doesn't look like we have any questions, any more questions, so we're going to go on. I want to share with you that we have some upcoming live events. The Happy Heart is a Healthy Heart is on September 25th. We hope you'll join us at 6 o'clock Eastern Time. And then in October, we have Diabetes 101, Mastering the Essentials, which is a fabulous presentation for anyone who wants a refresher or is getting started with diabetes on October 17th at 6 o'clock Eastern Time. And I encourage you to visit our website at ceciliahealth.com, and we have blogs at the bottom of our website, ceciliahealth.com. You can scroll down to the very bottom and you see our blogs. You can also check out other webinars that have been already recorded, and you can view them anytime you'd like. And then you can also visit our Facebook page. It's at Diabetes Innovation Hub, and this is on Facebook, and we hope that you will check us out there. And I thank you so much for joining me tonight. I hope you've all feel a little bit more excited about using your home glucose monitoring device to answer those questions. Thanks so much and have a great night.